ICU delirium is a really important topic. It's not talked about enough. When you're in the ICU, you can get delirious. You can be confused. You can be disoriented. You cannot know where you are. You can have hallucinations. And if you are delirious, your mortality is actually worse. You have a more likelihood of dying when you're in the ICU with delirium. So it's very important to recognize if someone is delirious. You can have hyperactive delirium, like agitation. You can have hypoactive delirium, like someone just kind of sitting there, kind of catatonic. They're both delirium. They need to be recognized and they need to be treated. First, you got to reduce your deliriogenic things that cause delirium, like sedatives and medications can cause delirium. Benzodiazepines in particular they can cause delirium. And then you got to make sure someone's sleeping appropriately. You make sure you have the blinds up in the day so they're not taking a nap, and that you are providing sleep aids like melatonin, things like that, whatever they need to help them to sleep at night. You need to treat their pain. Pain can cause delirium. You need to assess pain and treat their pain with multimodal analgesia, Tylenol, ibuprofen, opiates if needed. Have family. Make sure families are at bedside to orient the patient. Make sure they have their glasses on and their hearing aids in. If you can't see or hear, you're going to be delirious. And then make sure these patients are getting up out of bed. If you are up out of bed and you're exercising, you're able to orient more. You also are able to get a little more tired and you sleep better at night. ICU delirium is a very, very important topic. There's a bundle called the ABCDEF bundle. It's part of ICU liberation that I can talk about that another time. Very important to implement in ICUs.